We want to thank Dr. Tsion for being here with us today. She is the Doctor of Emergency Medicine in New York, as well as a special advisor to the Ministry of Health of Ethiopia. And we appreciate her for serving on the front lines, for all that she does, along with all of the healthcare workers sacrificing so much right now. And I also want to make a couple disclaimers about this session. Number one is that Dr. Tsion is not representing any organization she works with, and she's not acting as a spokesperson for any organization she works with either. And she also will not be issuing personal medical advice during this session. We are so grateful that she's here today to just give us some information and everything like that. And we thank you all for being here with us too. I see some familiar faces. I see Changemaker Saga, who's in North Carolina. I see Tamara Horton, who is in New York City with Studio Samuel. I see Saba Mallory, and I see a bunch of other wonderful people in this chat. So thank you all for being here.
What can we do? I think stay home for all of us. A lot of people in this country are doing it. In New York, unfortunately, we learned it a lot later. And it's really, for me, I just think that this is social distancing is the battle now. And it's really about us practicing it. Think of it like a war. You don't see the witness. You don't witness the war because it's happening behind the hospital gates. So it's important that this is almost the equivalent of the Third World War, and that you as an individual do your part to stop the war by staying at home and let the people who are fighting it, let them fight. And one thing I would say, I think as a culture, especially for Ethiopian Eritrean culture, there's a lot of stigma about people that are isolated, that are recovered. I think it's very important that the solidarity with everyone, and that we continue to support and check on everybody that has recovered. So I think it's important that, especially people that are here, we have so much access to information. So if we have family members back at home, very important for us to teach those things that, you know, people are, it's okay to physical distance. Like social distancing doesn't mean that you can't call and check on them, that you can't tell them that you're praying for them. Those are okay. It's just like, you know, we're not there, and we won't be there physically next to each other, but I think it's very important that we show solidarity with people that have recovered. I mean, I've witnessed it. I've witnessed the stigma with getting sick with COVID, and it's very, very important that we, as a country, as a culture, as a human being, that we don't pose any kind of stigma towards people that are recovered.
Dr. Tsion, I have a few questions, and then we do have some that were submitted by different people that I'd love to get into after this. So where do we stand with testing from what you've seen here in the US as well as Ethiopia?
Well, I'll be very honest, testing was also very not easy for me and my husband. Especially initially, and people like, you know, I was actually on the phone talking to my workforce people about getting tested. In the first week, it was not me, just there were a couple of other of my colleagues that were sick. And when it wasn't that much, a lot of people they end up getting tested. But when it finally came the second, third week, they just couldn't keep up. So they said, unless you have this medical conditions and you're needing to be admitted to the hospital, you don't need to be tested. And to be honest, that's what I've been telling people too, because it's just not been that many tests for the city. You know, unfortunately, unlike what you hear on the White House press releases, saying we're doing a whole bunch of tests, but then in reality, I myself, and I did a couple of interviews with NPR, with Channel 4 News about this, really how it's been very difficult to get tested, me myself as a healthcare professional. And at my hospital, you know, I still didn't get it when I had the symptoms, when I had the active symptoms. So I eventually had to go to an urgent care, pay, and get it done. And that was because pretty much what I was preaching is what I was told. Like, you know, I thought, you know, they said they would have exceptions to healthcare professionals. Department of Health, all over the website says healthcare professionals do get priorities. It's not like I am thinking that I'm better than other people to get tested, but knowing that I have recovered from it would really give me a sense of reassurance when I go back. I will still have the PPEs, but really just to know that I had it. And the second thing is I was really interested in donating my plasma, because there are a lot of people of color that are dying because they don't have. So I wanted to be able to do that too. So And in the city, it's been very difficult to get tested. The numbers might change. And the only reason my husband was able to get tested was because I knew people that were doing experimental antibody testing. And it was during the time that they still had the capacity to do it. Like after him, actually, there are a lot of people that got turned down because they said we just have too many people that we're testing and we're doing this. So it's been very difficult. And in Ethiopia, we have to invest in prevention because we do not have the capacity to build the hospital overnight to meet those numbers. So the screening and the very, very vigilant screenings have happened a lot more, even the airport screening. I came from Ethiopia to US on February 23rd, which is when there were not a lot of cases. There are people that flew to New York on March 15th and still did not get asked at the airport where you've been. This guy flew from Spain. They didn't even ask him where he came from, right? So the airport screening at a lot of the airports in sub-Saharan Africa, including Ethiopia, has been very vigilant. I will say again here, because testing is still limited, despite what you hear on the White House press, I'm sorry about that, say that. I'm not trying to speak against this administration in a way, but as a public health expert, what we're seeing and what's being translated on the ground are two different things. And I am very verbal about this. I tweet about this. I posted on IG. It's just what's being seen there and what we're seeing in daily life, the drive-through test and everything. No, I called Department of Health 2 weeks ago. They still haven't come back to get tested. So there's a big discrepancy between what happens in reality. So, and I would say this, knowing the resources, I think it's important that if you do have the symptoms, you're worried about COVID, they're not bad enough to stay at home. Like especially if you can self-isolate, you don't have any other risk factors unless you are having severe symptoms that you need to be hospitalized. At this point, if you're not a healthcare professional, I would say stay at home. But you know, if those public screening, antibody testing comes to whatever city or whatever country you're in, then great, go do it. But with the limited testing that we have, then it's going to be very, very difficult.
Thank you for that. Let's hope testing expands, right? And resources continue to come in both here and really across the world. And I want to take it into a different direction because a lot of us are wondering, when will this end? So from your experience or from what you're seeing with research and, you know, within the medical field, is there a timeline we can even kind of project toward right now?
Yeah, you know, I want to be hopeful and say it's April 30th, but I don't think it's going to be it. We're just seeing the plateau, and after the plateau, we don't know how long it's going to stay in the plateau. This is me just speaking for New York, like, you know, and I think if we don't contain it well in New York, the rest of the country should not be opening back. And then, again, what is very important that, you know, it's not going to be a switch, right, on and off, like, hey, you know, social distancing. It's going to have to be a gradual reopening, or else we're going to see a rebound. And who wants to be back again to the state, right? It's just better to get over with once and for all and get it, then a move on. So, you know, in the US, I was optimistic for April 30th, but I know it's not going to be the case. The plateau, we don't know how long it's going to last, but even with the opening, it would have to be, you know, step by step. If we are really going to test more people, I still do believe that since we're not mass testing, we are seeing the tip of the iceberg. So what we're seeing now in New York and the plateau is because of the public health event that was implemented 2-3 weeks ago, right? Mm-hmm. So now if you just open it up all of a second, and then just that number is going to go up back again. And I think it's very important that we're patient through this. I think it's better to get it over with. And I'm really praying that we'll have a summer. Unfortunately, my birthday trips have to be canceled. So I'm going to have to celebrate my birthday in my little small living room here. I was supposed to be going to Jamaica next week. So unfortunately, that's not going to happen. But, you know, if it is first week of May, then it would be great. But we know it's not going to happen. And we'll just have to accept it with just have to accept it graciously and take it in as it is.
Yeah. I think it's important to start thinking like that, because we don't need to be thinking, oh, we're going to be back and running by Easter Sunday. That was yesterday. So let's all just try and continue taking the social distancing serious and doing our part in any way we can. I want to get to a couple questions that people had that they submitted. one question was, can you touch base on the use of hydroxychloroquine, which is a malaria drug in New York for COVID patients? We know that this is controversial. We've seen the administration come out and really push this malaria drug, but we've also seen some doctors saying it's working very well for ill patients, and then other doctors saying not so much. So do you have any thoughts on that, Dr. Tsion?
So I want to be really positive, and I don't want to be the devil's advocate for everything. I don't want to be the Debbie Downer, but I think it's important that a lot of the things that we're seeing so far are only anecdotes, meaning it's just very small cases from 10 to 12 people. We also have to understand there are a lot of side effects with this medication. So we have to take with a grain of salt the information that we're seeing now. Some of the results have been promising, but again, the numbers are so limited, and I'm hoping that in the next few weeks we'll have positive data coming out to prove or disprove this. But I would say it's not the magic bullet, and at the same time, it's going to have to get and generate more evidence to show that it really works. We in science believe that when you have more numbers and when you have what we call randomized controlled trials, and then we have the results, then it's not going to be a biased outcome, and it's important to get on that, because hydroxychloroquine is just a terrible drug unless you have to be on it. It could cause cardiac dysrhythmias. It could cause a couple of other side effects from this, and people could die from it. And we've seen stories of people just prophylactically taking it and dying as a complication of that. So people could lose their vision from this. So every drug or intervention is going to matter. So I think it's very important that people take it with, like anything, has its any medication has its pros and cons. And people calling and telling me take hydroxychloroquine. I'm like, I don't want to take hydroxychloroquine because I know that I'm healthy enough for my body to fight this off. So I think it's important that HIV drugs, people talk about steroids, it's all anecdote. So let's not get too excited about it before getting enough evidence.
Okay. Another question that someone had, I know you had the slide up earlier of how long the virus can stay on surfaces, but someone asked, can people carry the virus by their shoes while working in a hospital or a pharmacy?
Yeah, so we've seen it earlier based on the slide that I showed on plastics. It can last for several hours, and it's very important, like when I walk in from work, that I leave my shoes by the door. And if I have to bring anything like my bag, my purse, you never know where you might be able to pick up the virus now, especially in New York, because it's everywhere. So it's very important that if you are working in places like hospitals and stuff, disinfect, spray and wipe everything else that you're bringing. That's aluminum, plastics. So, on plastics, it could stay up to 3 days. On gloves, it could stay up to 8 hours. So on mostly like cardboards, it could stay up to 24 hours. So it's very, very important that you wipe whatever things that you walked on outside, or whatever clothes or whatever things you're wearing, and had touched the surface at a place that might have COVID. So that's important. Just another question that was sent to me privately here is, are people of color more susceptible to COVID-19? So it's not a matter of just more susceptibility, but again, we need to have more data. Most of what we're seeing are from Europe and China. But I think it's very important that the data that we're seeing are more people of color are dying from this disease because of the structural racism about healthcare. I say this as a person who works in inner city hospitals, because most people, low socioeconomic status and people of color, unfortunately, do not have, and the immigrants or the documented or undocumented, unfortunately, are less likely to have health insurance and have a safety net of their primary care doctor that can call. And unfortunately, they also have other conditions like high blood pressure, diabetes, and all those things. So, if we were just to look at the color, it's very difficult to say now, but we're seeing more people dying from it because they are at increased risk of having underlying conditions that puts them at increased risk of dying. So the death is we're seeing disproportionately, and I think it's not only a matter of income. It's just it's just a matter of having less resources and access to healthcare.
Thank you for that question. So we also want to answer, I know a lot of people want to somehow help back home? What are ways people can get involved?
So, it's everything that I said earlier. There's a thing about, we joked about and say that infodemic does more damage than the pandemic, meaning that it's very important that we are sharing good information, evidence-based, and it's not time to politicize this at all. This is a war against humanity that we all have to overcome. So I would say that it's very important that in addition to sharing good information and telling your family members, it's very important that people do listen and not ignore the messages that are coming from the Ministry of Health and the government. So that's very important. And like anything else, I think of this like a forest fire, right? So I think whatever you do as a person, as an individual, whether it's what you share on social media or how you share with people, it's very important to be a person that's adding water on the flame, not be the person that's adding a piece of fuel to the flame, because it's very important that we all work towards stopping this fire from spreading. So, I'm hopeful that the next few days that we'll get real numbers in Ethiopia, whether it's narrowing down, whether it's increasing, whether it's like spreading like a forest fire. But what we do this week is going to be very, very detrimental. Like it's going to be very, very important. And it's important that you guys share that with your family members, because people are going out for Easter, meeting and going shopping, and it's just going to undo what we did the past few weeks. So it's very important that people do it. So there are 2 questions on the side here. I don't know if you want to just...
Yeah. So let's see. We have, thank you Changemakers for this timely and informative session. And thank you Dr. Tsion for your selfless service to humanity as a healthcare professional. Dr. Tsion, how are you coping with all these unprecedented moments without any perspective for all of us? Can you also talk about how long after recovery when it is safe to be around others? Stay safe and be well. That is from Changemakers Saga.
Okay. The first one, I guess I kind of answered it, how you're coping. It helps to have the very positive messages from everything. I see and I celebrate small wins. It might not be like, having a good turnout when you make a food. Like those things just, it has to make you happy. And one thing that happens at 7 o'clock I look forward to, and I've talked about it in different platforms, is all of New York City steps outside and claps, and I do take that as a very special moment for uplifting and for really to continue to do what I do. And at the same time, people, I'm not like such a, I do appreciate everybody's support, and I do think it's a bit overkill to call us hero, because to be honest, before COVID or after COVID, we do work so hard to do save lives, and it's just what has changed this is because of the amount of pressure that's put on the healthcare system. So I think I've appreciated what I do more than ever. I've never felt proud and honored, and also very so what I'm looking for, but I feel like there's so much of a big responsibility that's bestowed on me. So I feel like, I cannot, there's an added pressure not to fail people, but there's also this increased sense of responsibility besides what I do at work, but really to teach people, because what I'm learning through this process is that how people, even very smart people, are how uninformed they are. The reasons that we hear some politicians really highlighting on the importance of healthcare for all, universal health coverage, is those reasons. And that I think has given me the purpose to speak more. Minus the weeks that I was sick, I've really made it a point to talk more on social media and take advantage of an opportunity to teach people and to be able, I do teaching classes, that's, I work as an assistant professor. So to be able to take that to more platforms, I think that's been something I'm finding gratifying. So to answer your question short, is just keeping myself busy has been the way I've been coping with this, and I do enjoy doing it. So that's why. And the second question was, what are the most common myths about COVID that physicians should dispel for patients?
And on that note, I do want to mention while you're answering that one as well, can you also talk about, there's a lot of these remedies floating around in the Ethiopian and Eritrean community. The parents and aunties and uncles are all sharing, you know, these drinks and these mixtures that they are saying can heal people. So can you also comment that as well when you're answering that question?
Yeah, so I mean, even me as a physician, when I do have my cold symptoms, you know, drinking a hot tea, drinking like the, you know, the remedies that are, you know, what my mom and what I've grown doing, I do like you now, you know, putting different oils on my humidifier, or making a ginger tea, and as much as I do not like it, having to put garlic in everything that I do eat. And thankfully, like most of what we the symptoms that I had was not anything with respiratory symptoms, so I didn't have to, like, you know, drink soup and do this, do all that stuff. So whatever made me, my symptoms made me feel better, I did it. So it's okay to do those things, but you have to understand that it's not going to heal your symptoms. It's just going to make you feel better, like how you take over the counter medications when you have a headache or so. It's like people different oils on their foot, and it helps them. If it helps you, sure, but it just doesn't mean it's healing you. It doesn't mean that you can go outside and avoid social distancing. So I think it's important that we take that with a grain of salt. And there was some ridiculous things that I've seen, that open your mouth and put a hair dryer to, like, you know, to kill the virus from your throat. I'm like, people are saying the most insane things ever, but please do not light yourself on fire when you're trying to heal yourself from this. So avoid this. Such advices, I think, support to take it from healthcare professionals, but things that won't hurt you, like drinking a hot tea with ginger, it's okay. You know, I think we have to use our common sense too for that. And I think, Sammy, that answers most of your questions, especially when it comes to the Ethiopian culture. You know, some herbal medicines that have shown to eventually work for other things, but we don't have the evidence, the scientific evidence. We don't know how to dose it. So it's very, very early to say that. And one of my biggest fight, actually, when I was going through this, is people tell me to do different things that's going to help me or heal. And it's just that I just tell them, please do not call me those recommendations. It just makes you angrier and having to explain to you why it doesn't work. So I know some things were well-intentioned, but it was more annoying to try to trying to demystify all those myths. So it's very important that we take that with a grain of salt. But it's okay. Like, people were saying the fever was so bad that I just went and took a cold shower. It's fine if it helps you with those things, but it's not going to heal the virus. So I think it's important. Some of the things, I think, Sammy, in addition to, I guess, mostly in America, it's not us physicians only, but as a public health intervention. Unfortunately, in some lower areas, we still see a lot of people gathering, saying, you know, I don't have any symptoms, I'm going to be okay. I'm not going to go, especially the young people, not listening to the advisors and say, I don't have any symptoms, I can go outside, play. Like, even now, people are playing balls in the park, you know, rolling dices and say, I'm okay, I don't have any symptoms. But you're using a ball, you're using dyes, and somebody else who's not there showing symptoms could give the virus to you. And it's very important that, you know, people do understand that. And then that person could go to their parents and their grandparents at home and make the symptoms, you know, eventually pass that disease to the vulnerable populations or vulnerable people in your house. So it's important that, especially, I guess, a lot of people that are on this platform, that they understand that.
Thank you all so much for your questions. I'm just going to ask one more final one to wrap everything up here, and then we're going to conclude this presentation. But again, thank you all for joining us tonight. Dr. Tsion, as we wrap up, we want to end on sort of a more hopeful note, and we can't say thank you enough for all this information, for your vulnerability during this conversation, and more importantly for your courage, for being brave out there. And we will continue to support you how we can. And so if you could just share during this time any words of encouragement for all of us. I know we're in this fight together, but anything to anybody watching this right now as far as pushing forward?
I think a lot of people are, especially people had to adjust to most of their living and having to stay at home, especially people that are young, active, want to do a lot of things. I understand it's a very, very difficult time. But I think we have to think about this once in a lifetime opportunity. Hopefully we'll never have to go like this, but I think it's important that we do stay inside, and it's very important that we engaged in different activities that would help you become a better human in general. And I think the versatility and the resilience is part of this. And somebody shared a quote with me once about social contract, which is what this country was built on, that you have to give up a bit of your freedom and you sacrifice for the greater good. And this is not like an active war that we're going fighting. And like I said earlier, there are people doing that for you. So thank them. But I think this is your sacrifice for the greater good and for saving lots of lives. Like what I do in the emergency department is what you fail to do. When you fail me and not social distancing, then I would have to work harder and I would have to try to save more lives. But if you can stop that from coming towards the hospital, means you're not adding more people to fire, then it helps. So what you do is, like, I know you might not see a directly correlation, and what the Governor Cuomo of New York said is, when somebody sneezes, somebody dies. So for me, I would like to take it a little bit further. So when somebody leaves the house for non-essential purposes, then somebody dies. And there's a direct correlation with that. But I know it's not prevention, and not seeing the real outcome in front of you might be a bit discouraging, but really the true heroes are the people that are preventing from this disease spreading. So you guys are all the heroes in this.
Thank you so much, everybody. If we could clap it up for Dr. Tsion. Thank you,
guys.
And we thank you all for tuning in. We hope you all enjoyed this. Please stay connected with Dr. Tsion on Twitter, on Instagram. She's constantly sharing ways you can get involved, and also information on the latest news regarding COVID-19. Thank you, Sister Dr. Tsion. We love you, proud of you. We're going to pray for the protection over all healthcare workers. And to everyone who tuned in tonight, we're sending you our love. We're thinking about you and your families, and just keeping you all in prayer as well.